It's not something you'll likely see anywhere else. This is a giant inflatable colon on display at St. George Regional Hospital. Intermountain Health kicked off this unique interactive opportunity to show what the inside of a colon looks like and why it's so important for colonoscopy screenings.
This cancer really lends itself to prevention and early detection. For that reason, it is important to screen for colon cancer.
This 12-foot, 113-pound inflatable colon depicts different stages of polyps that can be anything from benign to precancerous and even cancer.
The symptoms can be fairly nondescript, but bleeding, blood in the stool, pain, change in bowel habits are among those.
However, sometimes there are no symptoms. That's why colon cancer is called the silent killer.
I have a history of colon cancer both on my maternal and father's side of the family. I lost my dad at 52 years of age and also my grandfather on my mother's side at 62. So because of those risk factors, I had to start getting screenings at 25, just a year after my dad passed away. At first screening, they actually did find 2 polyps, precancerous polyps, so those were removed during the screening. And because of that, I have to go in every 3 years just to make sure everything looks good and there's no additional developments.
The screening age was recently lowered from 50 to 45 because the incidence of left-sided colon cancers has increased.
The tools used to look for polyps may look a little ominous.
What we have here is a colonoscope. This is what we would use during a colonoscopy. It can be kind of intimidating. It looks a little big, but I promise most people don't feel a thing because they're nice and asleep for this.
By turning the knobs, the colonoscope can be used to navigate and even take pictures using a light while making its way through the colon.
So the images that we collect are saved in a system, and then we're able to print those and give those to our patients.
It can also take samples of polyps for testing after they are removed. The prep, which requires drinking liquids to clean out the colon ahead of time, is more of a discomfort than the actual procedure.
The preparation is a little challenging sometimes, but it's a small price to pay. It's only, ideally it's only once every 10 years.
Intermountain plans to take this giant blow-up colon to 22 different hospitals and clinics through the month of March to show the importance of early detection.
The more awareness we make on this important subject, the better off I think we are as a society.
From St. George Regional Hospital, Melissa Anderson, Community Education News.